We're hitting another important milestone in the vaccine rollout. More people becoming eligible tomorrow, but it still is confusing for many. Our 9 Health expert, Dr. Payal Kohli, is joining us now to answer some questions regarding the vaccine itself, or themselves, I guess. So now 3 different options for the COVID-19 vaccine are available. A lot of people are wondering if they can actually choose between vaccines. Is that something you advise?
You know, Tom, I get this question every single day, and I tell all my patients, you get the first one that you can get. Because remember, comparing the vaccines head to head is really faulty science. The trials were done at different times. They were done in different countries with different populations with different types of vaccines. So it's really faulty to say this one is, 85% versus this one 94, this one 95, because it's just not an accurate comparison. We do have to keep in mind that all 3 of them are 100% effective at keeping you out of the hospital, keeping you out of the intensive care unit, and keeping you alive. And remember, that's really what we're looking for, turning this severe life-threatening illness into something, mild that you could recover from at home. That's what we're hoping the vaccines will do, and they're all going to do that. So I'll say just get whichever one you can get first.
So we hear those high numbers when it comes to efficacy, all the way up to 100% as far as staying out of the hospital or possibly even dying. But some people are asking about immunity. How do you know that if you get the vaccine that it works? Should you be getting an antibody test afterwards just to make sure?
This is also really popular right now. A lot of people on social media talking about this. So an antibody test, remember, is a marker that your immune system has seen that antigen, the spike protein, or whatever you're testing for before, whether that's through natural infection or whether that's through vaccination. But at this point, none of the guideline societies or committees, the CDC or anyone else, is not recommending getting antibody tests after you get the vaccines for 2 reasons. The first is we don't really know what an antibody test after a vaccine means because it wasn't studied in the clinical trials. We looked at clinical endpoints. Are people getting into the hospital? Are people getting symptomatic COVID, so on and so forth. So we didn't really check everybody's antibodies after the vaccine. And what we also know is that antibodies are just a small part of your immunity after a vaccine. You also have other types of immune fighting cells. And with other vaccines, we know that even after sometimes people get them, they may not mount antibodies, but they're still potentially protected. So we don't know how to interpret a negative antibody test, for example, after getting the vaccine. And then the second part of that is we don't know if the tests that we have out there for the antibodies are appropriate to apply to vaccinations because they've only been validated for use against those that have had natural infection. So I would really caution people not to get carried away and want to check and make sure and get an antibody test, because if it comes out negative, it doesn't necessarily mean that you don't have some degree of protection. If you are going to get it, you want to wait at least 3 to 4 weeks before you get it and ask your doctor to help you interpret those results.
This is an interesting question. As far as herd immunity coming around, will there be a difference from people who get immunity from the vaccine as to those people who got immunity versus a natural infection? And will it matter? Is there a difference between those?
There is a difference, and the difference could be both the depth and the duration of immunity. So what we're seeing is that those people that have had COVID and recover, if you take their blood and mix it, with the virus, it's not as good at neutralizing the virus as the blood of somebody who's had COVID, recovered, and got a vaccine. So we know that the vaccine really does tend to boost your immunity, and we do think it's important to have that vaccine even if you've had COVID. Now, for people who've had COVID, they may want to elect the Johnson & Johnson single-dose vaccine so that they don't have as severe side effects 2 times around. But that's a little bit of a digression. But it's also important for us to know how well the vaccines are working. So once we've had most of Colorado vaccinated, we're going to want to know if somebody feels sick, do they have COVID? And one way to tell if they have COVID, if they didn't get a PCR test while they were sick, is to get a special antibody test against the capsule of the virus. So there's 2 types of antibody tests. One's against the spike protein and one's against the capsule. If you get a positive antibody to the capsule, you've had the virus before, because all 3 vaccines are designed against the spike protein. So antibody testing can help us determine who has immunity through which method, and that can have implications for how long it lasts and obviously, the rest of the state, how quickly it gets immune.
That last part really reminded me of when I was in school, and the teacher was really smart, was saying some stuff that was really important, and I couldn't keep up. So Play that back,
sorry.
people. No, when it's between the capsule and the spike protein, I mean, there's a lot there. There's a lot of good information, but it just, for me, it was a sad flashback to school when I knew that I was starting to swim. So we will keep tabs on this and keep talking with you and keep learning more. Dr. Payal Kohli, thanks again.